Learning objectives include how immune complexes are formed and what is a type 3 hypersensitivity and how to diagnose and treat it. Third type of hypersensitivity is immune complex mediated hypersensitivity. The difference between the second and the third is a very subtle difference, and that is basically the antigen. Here, the antigen is soluble and is floating in the body, is not attached to any cells. So, any antigen that enters into the body by rule of immunity would induce antibody production. And the body tries to clean or clear that antigen from the body. So, immune complexes are formed because this antigen is soluble, so would be found mostly in the body fluids. And the most abundant body fluid that keeps circulating all the time is blood vascular system. So, what happens is that these immune complexes, they are formed inside the blood vascular system, where the antigen binds to either IgG or IgM or both. And these immune complexes, ultimately, when they reach to the capillaries, they get stuck there because these are sometimes these are a kind of network of complexes making quite big structures, and they get stuck in, especially in the kidneys, where the blood is filtered for those waste products. There's a special mechanism, special structures available in the kidneys, glomeruli, that do this job of filtration. And these complexes, they lodge there, they get stuck there. So as this is an antigen-antibody interaction, and as soon as they lodge there, they activate the complement also. So, in other words, we could say that those immune complexes, when they are running in the blood circulatory system or floating in the system, they do not cause any harm. But once they lodge, they deposit onto the surface of these cells where they get stuck, like in the filtration assembly or apparatus of the kidneys. They then invite complement also, and that complement does what it has to do. It punches holes inside the cells and causes the damage. And this is hypersensitivity type 3. Immune complex is mediated. This is an example here that those antibody complexes, antigen and antibody complexes, they get stuck into the cells, and then complement gets activated, which also, complement also invites other neutrophils also to the area, and neutrophils then can release chemical mediators and even can engulf them. So the damage is enhanced. How this could be diagnosed? As you know that these are immune complexes. The only site that we can use for diagnosing is those areas of the body where these immune complexes lodge themselves, and kidney is one of them. So you need to take a biopsy if you suspect somebody of having kidney troubles, like kidney failures. One of these components could be there, although there are many other causes of kidney failures. But this is how you could diagnose this. Confirmed by biopsy, of course. Then the treatment. Again, you cannot really do much. Even if you diagnose the kidney failure is as a result of these immune complexes, if you know the antigen, the nature of the antigen, avoid that antigen. Or you treat the patient symptomatically by giving corticosteroids. They are anti-inflammatory drugs. Corticosteroids decrease the inflammation or inflammatory process. So it's a kind of symptomatic treatment. So in summary, type 3 is immune complex mediated hypersensitivity, where immune complexes lodge into the cells, onto the surface of the cells, inviting or activating complement, resulting in the damage to the cells.